Dr. Vora, why are women more likely to be over-medicated?
Yeah, it's really, women are more likely to be over-medicated largely because we're underrepresented in clinical trials. So our dosing strategies are based on how medications interact in male bodies. We have a recent trial for a medication that's basically the female Viagra. This is intended entirely for women, yet 92% of study participants were men.
Did you say that the female version of the Viagra, the studies that were looking at that, 90% or more of the participants were men?
One particular study, yeah, and that's actually quite common.
Even though it's for women?
Even though it's for women.
Well, it's not surprising then that women who are over-medicated, they're twice as likely to have adverse effects.
Yeah, there are many barriers to why women aren't participating in trials. Sometimes it's things like childcare obligations, but it's also this idea that women can at any point be pregnant, and so you might risk exposing a fetus to an experimental medication. But there's also this really interesting belief that the fluctuating female hormones might make it difficult to get a really clear understanding of how a medication functions in the body. It might confuse the data, but that's exactly the point. Women's bodies do behave differently with medications. In recent years, 80% of the drugs pulled from the market were found to be more harmful for women than for men. And we have the case of Ambien. In 2013, the FDA actually cut in half the recommended dose of Ambien for women, because what we were finding is that women's bodies eliminate Ambien more slowly than men, and so we're more susceptible to next day impairment, basically putting us at higher risk for car accidents the day after taking Ambien. So women's bodies just aren't designed to take the same type of dose that's given to men in clinical trials.
And I think it's important to note, it's not about men are stronger than women or women are weak. It has nothing to do with that. Our bodies, the genders, our bodies behave differently. That's just science. That's, it's nothing to do with kind of our behaviors. And I think that people need to understand that, the differing doses is not because women can't handle something, but because the bodies behave differently. And so, Dr. Vora, I mean, how difficult is it to get off antidepressants? And are patients told this before the doctors prescribe them?
So we are in a silent epidemic of people struggling to get off of psychiatric medications. It can be incredibly challenging because it causes withdrawal, and that withdrawal can feel like depression, anxiety, panic. And we're not really having a public conversation yet about this. So when people struggle, they feel alone. They attribute their symptoms to relapse of the disease rather than to the withdrawal syndrome that they're in. And we do have a total lack of informed consent around this, meaning when a doctor is initially prescribing an antidepressant medication, they're not necessarily informing that patient the fact that if they one day decide to get off the medication, it might be very difficult.
Well, Wendy and Dr. Vora, this is great information. The documentary is great. We've actually added a link to our website, thedoctorstv.com, that includes upcoming screenings for the documentary, Medicating Normal. Thank you guys for joining us.
Thank you.